In August, on the Forest Park campus, St. Louis Community College presented the 2018 State of the St. Louis Workforce Report.
We have a serious workforce gap issue in St. Louis County.
For the past 10 years, the college has tracked the recovery, growth, and challenges of our region's jobs, informing employers, educators, and community organizations of the needs of our area's workforce.
What are the skills that are necessary for the job that I'm hiring for? And does that individual have the skills?
The greatest takeaway? Our region needs a skilled workforce. Pay, of course, varies from job to job and level of training and experience, but many pay in the $30,000 to $50,000 range and some higher. In St. Louis, there are more jobs than job seekers. The 2018 report highlights the employment needs and opportunities in St. Louis in the fields of information technology, finance, and healthcare.
We have the busiest emergency room in the state of Missouri, over 105,000 emergency room visits.
Rick Stevens is the president of Christian Hospital in North St. Louis County.
One of the things I think that surprised me is that in healthcare, we've known that we've had a shortage in workers, especially nurses, but now it's expanded beyond that. Now it's even with paramedics, it's with radiologists, rad techs, or laboratory technicians as well. But I think this morning it still showed that we're a little late in trying to close the gap, but we're also working on that as well.
Any other daily medications to take?
Operating their own emergency medical services, Christian responds to approximately 40,000 calls a year, using their fleet of 22 ambulances and 3 command triage vehicles. A shortage of EMT/EMS workers at Christian Hospital would negatively impact their ability to meet the emergency medical needs of North St. Louis County.
Here in North County, with the demographics that we serve, not a lot of people have access to health care like they should. So the demand is high for any kind of health care, and a lot of times they end up in the ER. So it's important for us to have the coverage that we do.
So in the last few years, they've become proactive in training their future workforce in emergency medicine.
You guys were responding to a medical alert. The notes in the CAD state that there's a woman that lives there that has a medical alert. She is deaf and mute.
Parker Malinsky is class president of the current EMS Academy class. They are halfway through their 1 year of training, and today students are running mock emergency scenarios.
Go ahead and give them some atropine.
When you do these types of activities, they put you through these real life situations.
Real life situations, yep, 100%. Has she been acting weird? What's going on?
No.
Nothing?
No.
Okay. How do you guys communicate? How do we communicate best with her? Just asking her verbal commands?
The academy is located on the campus of Christian Hospital, where students earn EMT and EMS credentials. And there is a difference between the two. EMT is Basic Life Support Certified and EMS is Advanced Life Support Certified. Acquiring an EMT certification is the first step in pursuing a career in emergency medical services.
EMT takes a semester, paramedic takes at minimum a year, and also here at the academy we have a minimum of 600 hours of clinical time, and you're learning all the in-depth things. It's all the critical thinking and disease processes, medication, all of the emergency medicine. We've really taken the ER and put it on wheels and put it out into the community.
Immediately following high school graduation, Malinsky, now 19, began EMT training, graduated and got a job at Christian Hospital, and he schedules his shifts around his training for more advanced life support certification. Even at his young age, Malinsky has his career pathway figured out.
I plan on going into the fire service. In order to be a firefighter, in most places you have to be a paramedic. They just need that license because fire trucks, they're really incorporated in the ALS, so like if someone's in cardiac arrest, instead of sending an ambulance that's 10 minutes away, you can send a fire department that's 3 minutes away. You can do the same stuff as we can, besides they're on scene faster, getting that patient care that we need.
It's just a little more pronounced because it's slower.
Is that a new trend where you've got these kids who are 18 coming out of high school looking for these careers in healthcare right away, or is this something that's always existed and I just didn't know about it?
I think that it's gone in waves. Everything's cyclical. So it used to be that it was something that somebody pursued right out of high school, and then it became a second career, and now we're seeing it trend back to the younger folks are coming in and doing it right out of high school.
It's gonna get tight on your arm, okay?
Was this sort of a way to shore up your own workforce?
In a roundabout way it was. The idea was we have EMTs and we're wanting them to move to that next step in their career, and we could facilitate that. But then also we have people that come from outside, and there's always going to be a need. There's always going to be a need for ambulances to respond to 911 calls. There's always going to be a need for emergency medicine.